So the correct anatomical position is um, standing upright, feet parallel, flat on the floor, upper limbs at the side, palms facing towards the front. Front is the blank here. And head is level, eyes are forward. And that is the reference point that is used to describe all this anatomical language. Sections and planes. Slices of the body are called sections or planes. A section is an actual physical cut that exposes the internal anatomy of the human. A plane is an imaginary flat surface that passes through the body, and there's three main types. The coronal, also called frontal, is a vertical plane dividing the body into anterior is the word, anterior, and posterior. Anterior meaning the front, posterior the back. Another plane is called a transverse plane that divides the body into the top or the superior and the bottom or the inferior. Another main plane is called the mid-sagittal plane that divides the body into right and left, equal right and left. Parallel to that of the mid-sagittal, you can have parasagittal cuts that also divide the body from top to bottom, left and right, but they're not equal portions, so they're unequal portions. And then a specialized cut is called an oblique that gives different views of the body that are needed for like blood vessels, for example, structure at an angle. And here's an image that shows these different planes and the views of the skull that can result from the cutting of the different planes. As you can see, in this view, the transverse, you can see the whole brain and the eyes. In this view, and you can't see the cerebellum or the brainstem. In the mid-sagittal view, you can see the brainstem and the cerebellum. So different planes give a different view of the body, see different parts in relation to another. A lot of times, well, never mind on that, we'll get to that. So directional terms are important, and they're in pairs, and they're used to describe relative positions of the parts of the body. Example, anterior is front, posterior is back, anterior, posterior. Dorsal and ventral. There's two names for front and back. Dorsal is the back, ventral is the front, anterior. Proximal and distal. Proximal is closer to the point of origin, distal is further away. So they're opposites. These images are best to go over directional terms: anterior towards the front, posterior towards the back, superior towards the head, inferior towards the feet, medial towards the middle, lateral towards the outside. Proximal is used, proximal and distal, you should note, this is just for the limbs. So proximal means closest to the point of attachment, where the arm attaches to the main torso. Distal is further away from that point of attachment. There's two main skeletons in the body. They're referred to, one is the axial, A-X-I-A-L region. And as you can see in this image, it's the red right here. Axial is like the axis of your body. It's your head, your neck, your ribs, your main trunk axis of the body. It also includes the sacrum, as you can see there. The appendicular skeleton, or the appendicular region, is everything else. It's your arms and legs, plus your scapula, your clavicle, and then your coccybones, which are your hip bones. Regional terms are important when you're talking about specific parts of the body. For example, this is the cervical region, the neck. You don't just call it the neck, it's the cervical region. Within this cervical region, neck, you have cervical lymph nodes. You also have cervical vertebrae. So if you know the regional terms, you are then able to know different terms as we go through anatomy. When I say cervical vertebrae, because that's a specific type of vertebrae, you will know that those vertebrae are located in the neck. And then there's a back view, front and back. For example, you can't see the popliteal region from the front view because it's the back of the knee. Within our body, we have many different cavities or openings in which organs are located, enclosed spaces. And usually they're named for the body structures around that area. Yeah, they're named according to their surrounding structures. Generally, there's a posterior or a back cavity and a front cavity that's further subdivided. So starting with the posterior cavity is completely encased in bone, and that's important to remember. So we're talking about cranial cavity, also called your endocranium. This houses your brain. Continuing on, you have your vertebral canal, your spine, that houses the spinal cord. Okay, and these are different, these posterior, because they develop at a different time. Okay, they develop together, your brain and spinal cord, pretty early on in embryological development. And this shows a picture of that posterior aspect in orange, the cranial cavity, your vertebral canal. This is your posterior cavity. Everything else, this aqua, red, pink area, is your anterior cavity, or ventral is another name for that. The ventral cavity is larger, and it's in the front, like we said, and not every part of the body is completely encased in bone. And it's partitioned, that means separated. The top part is called the thoracic cavity. I'll show you that word here. I can pull it up if you're having trouble spelling. Thoracic cavity. It's right there. And the lower part is a very fun word, abdominopelvic cavity, below the thorax. And I'll show you this picture here. So the thoracic cavity is in aqua. The abdominopelvic cavity is both these, and it's subdivided further into the abdominal and the pelvic. So the main difference, like I said, the posterior cavity is covered in bone, and the ventral cavity is not for the most part. And so another main division is the ventral cavity, right here, ventral cavity. Within it, each cavity is lined with serous membranes. When you think of a membrane, think a covering. So these coverings are important because, I'll just give you the word now, they reduce friction. And when organs rub up against each other, there is a layer around them that helps prevent friction. Since they're not surrounded by bone, we don't want friction to develop. And each of these membranes, so coverings, have two layers. There's a parietal layer and a visceral layer. Okay? The parietal layer covers the body cavity itself, and then the visceral layer covers the organ itself, the viscera. And then just think of an Oreo or a sandwich, okay? The bread would be the layers, and in between them, the jelly is the fluid. There's fluid within them that helps prevent friction when they rub against each other. The best analogy that I've ever come across or seen that helps really explain those layers is, think of your fist like an organ, like a heart, because your heart's about that size. And if you have a balloon and you stick your fist into the balloon, like you can see in this picture, the part of the balloon is touching the fist, right? And part of the balloon, the outside, is not touching the fist, the heart. And then you have a space between them. Think of that as your serous layers. The part touching the heart itself is the visceral membrane. The layer on the outside of the balloon is your parietal membrane. And then the air of the balloon represents the fluid that helps prevent friction. Within the thorax, so this chest region, underneath the ribs, you have smaller subdivisional layers. The first one is called the mediastinum. The mediastinum is this area in the middle of your thorax. It contains your heart, your esophagus, major blood vessels like the aorta. In that middle area. Within the mediastinum, you have the pericardium. And you can see in the nice blue there. That is the layer around the heart. The parietal pericardium is the outer layer. Now we're getting words upon words. And then the visceral is right next to the heart, like skin on a grape. And the space between them is called the pericardial cavity. So, okay, we're still in the thorax, the heart's in here, the lungs are on either side, and the lungs are also in their own cavity. Their cavity is called a pleura. And just like the heart, they have a pleural, a parietal pleura on the outside of the lungs and a visceral pleura, like skin on a grape, a layer right on the lungs. So lungs is your space here. And the space between is the pleural cavity. So we talked about the thorax. There is the diaphragm right there. And beneath the diaphragm, that muscle, is the abdominopelvic cavity that's subdivided into the abdominal in red. This contains most of your digestive organs, your kidneys, and then your pelvic area between the hip bones. So it's protected by bone, your reproductive organs, your bladder, okay, your internal reproductive organs, that is. And then the last cavity with fluid that we're going to talk about is your abdominopelvic cavity, is also lined with serous membranes. And this name of the serous membrane is the peritoneum. And the parietals on the outside, the visceral lines the organs in your abdominal area. And the cavity is the space in between them, because your intestines are all clumped together, and you don't, when they're rubbing, when you're, doing somersaults or whatever, as their intestines are rubbing against each other, you don't want it to create friction. So there is a lining membranes called the peritoneum in your abdominal cavity. And this is an image. Check this out in your book too to make it stick. This would be a mid-sagittal cut of the visceral peritoneum, the parietal, and the fluid in between it.